especially interested in the healthcare system in the United States during college. That was really the focus of my study. So while I always was very interested in global health, I was especially interested in how the healthcare in America could be looked at in parallel to some of the global health, what is commonly referred to as global health, looking at other countries, looking at that paradigm and looking at some of the situations that are occurring right in the United States. So I knew right after college that I really wanted to focus on the healthcare system in the United States and see how I could make an impact on that. So, I originally went and did comparative healthcare research, comparing the United States healthcare system with countries around the world to try to help get a better grasp about how we could evolve the healthcare system in the United States, and was then recruited by the governor of Ohio to come work here to do health and human service policy, to work on the health and human service policy team here. And it's been a very interesting experience. When I first came in, Ohio was doing a lot of transformational work on the healthcare system in Ohio, looking at a lot of quality indicators. And Ohio is a very interesting landscape because we have a large part of Ohio's Appalachia, and it's a very blue-collar manufacturing state, so you have a lot of poverty, and we have a very high unemployment rate in Ohio, so it has a very interesting dynamic of healthcare and lack of healthcare right here in the state. So it's really given me a chance to look at how you can make reform right within a state. It's also shown me, I think I was kind of naive going into it about how reform in the healthcare system can take place, and working in a political setting has really shown me the other barriers that I think a lot of times I just didn't really understand the scope of the barriers that politics sometimes place on implementing policy changes. So I think it's been a very enlightening experience for me. And then I've also been able to be exposed to a lot of different things, different programs that impact healthcare, and looking at the federal healthcare reform. I think it's been a really interesting experience to be able to see at the state level how federal reforms are implemented, and also just look at the burden that the states take on for providing healthcare, which I think a lot of times you don't, until you're in the setting, you don't really realize what goes into putting a state health care plan, or even Medicaid services together for people within the state, until you're actually in, you're sitting in the policy office looking at these decisions that have to be made on a daily basis or in a budget scenario. I mean, so it's very, it opens your eyes very quickly to the scenarios and things that you have to make decisions about. So
that sounds great, Kristina. Really inspiring. Just because we're a little bit short on time, why don't we switch gears now, guys, to focusing on the questions that have been sent in advance. So we'll start just very generically at first. We'll start with a question just about GlobeMed. So how has it been interacting with other non-GlobeMeders? Has it been easy to relate or difficult in finding a good niche of people who are just as passionate as you are about global health? Does anyone want to take a stab at this?
Well, and this is Kristina, and because of the context within which I work, it's a little bit different than having, it's not solely focused on global health. I found a lot of people that are really passionate about community health and creating healthcare systems within the state and at the federal level that will serve all Americans, and really putting the systems in place and the infrastructure in place within America so that we can have more equitable health care. So I think on that level I found, and that's more of the universal view of global health, that I found a lot of people that are passionate about that in my office, even people that don't do health and human services policy. And then I think, and I'll just put a little plug in for our coming alumni network, that I think what's been really great as we've been putting this alumni network back together is that we've really had a chance to reconnect with other GlobeMed alumni and kind of reignite that GlobeMed global health passion that, I think you don't always find that in other people. I think GlobeMed students are a special breed, and it's really great to have this network, and we're hoping to really expand it so that we can continue on post-college and share these experiences and, research that everybody's doing, or just discussions that people want to have about specific issues. So,
no, that dovetails perfectly into the next question. Someone wrote in to ask what are the best strategies at networking or connecting with others in our areas of interest. Alumni, what kind of advice do you have for connecting?
I could take this one or talk a little bit about this. This is Ron, by the way. I would say the thing to just pay attention to the most would just be speak up at any event that you're at. When I was in D.C. this past summer, I just basically tried to go to as many events as I could, because they would have a lot of the free public panels and talks that they would have on all sorts of things. Many of them were actually in global health. And a good trick that I found was after the panels, they usually have a Q&A session. And if you can come up with a good question and you ask it, and you also kind of identify yourself as a student, like you'll get attention from people, because they'll be like, wow, this is a kid. He's like a pretty smart guy. And afterwards, you try to talk to people about your question, and then you get to meet a lot of people that way. So I think, and again, like, you don't actually have to. In terms of the types of questions you ask, I feel like almost everyone in GlobeMed would be capable of asking intelligent questions anywhere. And really, it's just the fact that they see a student standing up and speaking out, which is what people in GlobeMed do anyway. I think that really helps. So I would attend events that you're interested in and speak out of them and try to meet people. I think that really helps a lot.
Really great advice. Let's go to a question from Avinash. I'm sorry if I'm mispronouncing your name. But Ron and John, Avinash wants to know if it's advisable to take some summers off during medical school to acquire different experiences, such as working at an NGO.
I can take this one. So under like the standard curriculum at pretty much every medical school, you really only have one summer. You have your first year, which will go from, say, August, September till roughly May, and then you'll have that summer, sort of 2 to 3 months off in between your first and second year. And then you have your second year, you'll take the boards, and then pretty much immediately you have maybe a week at most or 2 weeks off. And then you start third year, which is a full year, and then fourth year, you do have a lot of vacation time. That's sort of for residency, interviewing, and then also for electives. And then that's when you can pursue like the international electives, like Ron said. Definitely in that first summer, that's probably where the best chance you can get experience working for an NGO, or maybe potentially during the fourth year elective when you want to do an international elective. And so the only thing with the elective then is it does have to satisfy some clinical requirements usually. But the first summer is really open for your choosing, and then and for instance, like myself, I'm probably going to be going to Ecuador and working with an NGO there doing Spanish immersion, but then also health education. So yeah.
Great, thanks, John. Divya, this might be a question from you. This is a question from Colin Lee. I'll read it directly. So for someone wanting to be involved in international health and working in community health clinics in foreign countries, would it be possible and worthwhile to apply for medical school after obtaining an MPH, or do people on this track attend medical school first and then pursue an MPH?
I think it's kind of up to the person's discretion. I think that for me personally, I thought that I would do the MD first and then do the